I'm Dr. Matthew Schaeffer with the Ohio Medical Group, family physician and sports medicine physician, and today I'd like to talk to you a little bit about sports medicine. Sports medicine itself is essentially the provision of medical care to active individuals of all ages, from the obvious youth sports, organized sports, participants to the weekend warriors, to people of all ages who are physically active or want to be physically active for the purposes of just general health and well-being. There are two concepts I'd like to briefly discuss that are currently useful for injury prevention. The first is prehabilitation. Prehabilitation is the concept of trying to prevent that injury. What we do for prehabilitation is find ways to build exercises, strengthening or flexibility exercises into an existing workout or physical activity plan or exercise plan with the intention of preventing the injuries during participation. There are three main anatomic areas that's currently the focus of prehabilitation. They are the shoulders, specifically the rotator cuffs, the core, including the low back, and the hips. These three areas simply because, number one, we tend to see a lot of injuries in these areas, and then number two, because these areas are often left out of traditional exercise routines or workouts, or focusing on these areas is left out, and then we end up dealing with injuries that occur to these areas because of that. And these are the type of areas that rehab is never fun, it's never exciting, and these types of exercises are less glorious than the other ones that we like to do during workouts. What we recommend is finding ways to build exercises, specific exercises, into your existing workout. The other concept for injury prevention is the concept of a dynamic warm-up, which does not involve static stretching, but rather moving the body in multiple planes of motion, multiple ranges of motion. But if you were to take 3 to 5 minutes before, build in a dynamic warm-up that could involve anything from lunges, body weight squats, high knees, lateral shuffles, running backwards, and invest those 3 to 5 minutes at the beginning of your workout. The point of the dynamic warm-up is to get your body ready for exercise. So by the end of the dynamic warm-up, you're supposed to have an elevated heart rate, elevated respiratory rate. You're supposed to be already breaking a sweat, so it's actually just part of the workout rather than a separate part. If you experience an injury or problem as a result of being physically active, I would encourage you to seek the advice of a sports medicine physician.